Hey everyone, in this video we're going to go over how fast or when will I see results after I do an umbilical cord mesenchymal stem cell therapy. So one thing to note is what I'm going to be commenting on really only pertains to umbilical cord stem cell treatments. I don't do bone marrow or adipose derived stem cells, so I can't really comment or speak to that. First thing to look at is it does vary. It varies on condition. It varies on the chronicity, how long a patient's had it, how overall healthy they are, dosage, things like that. So there are some nuances to it. The condition it does play a huge role. So in general, what we say is about 3 months is a good kind of timeline as to you get a good treatment done. And again, I can really only speak to what we do here or have treated here. So I will tell patients that about 3 months is kind of like the long end. On average, 2 to 4 weeks. 2 to 4 weeks for most conditions, especially orthopedic. So knee pain, back pain, hip, shoulder, something like that. After an injection, usually their pain level and functionality, pain level will go down, functionality will start to improve. So upper limit is we look at about 6 months. So everybody is so different that somebody's usually falling somewhere in between one of these time frames. With conditions that don't just have a couple symptoms, like an orthopedic condition that is, pain. Oh, I have pain here, and I can't move this joint as well. More dynamic conditions like autism have a wider range of symptoms, right? It's a spectrum. So it has a wider range of symptoms that we can see. So with those kind of conditions, what you'll see is some of the symptoms improve a lot faster than others. So usually kids will start sleeping through the night or sleeping more consistently. They'll become more affectionate. They'll become, their attention span will become a bit better. They'll start kind of listening. So those are kind of the earlier ones that you'll see within that first month or two. And something like expressive communication, like them starting to say words, piece words together in sentences, that will usually fall more like the 3 to 6 month range. Granted, they're doing work with speech therapy or a therapist or doing a lot of work at home. Chronic conditions, heart diseases, the dementia, stuff like that. Again, it could be a little hit and miss. You could see somebody in that first month or so start to really show some progress. Progress can look like it can vary. It can look like this, is where it's a steady growth of improvements in symptoms. It can be really sharp. These I call the stem cell lottery winners. You just have these people that they get improvements very, very fast. You can have improvement and then kind of a plateau, an improvement and a plateau and an improvement. And you can even have some people that show some improvements and then it kind of like wanes a little bit. They'll have a lot of improvements and then they'll almost have like a lack of progress, and then they'll start to see some improvements again, and it'll kind of seem like things are going back to the way it was. So you can have a lot of different scenarios to when it comes to somebody's improvement. And I think that does have a lot to do with somebody's lifestyle. Once they step outside of the clinic here, I don't go home with all my patients, and I'm not feeding you, and I'm not telling them what to eat, and I'm not taking you to do therapy and exercise. So everyone's a little different. I've seen this really, really low, moderate progress. It's slowly improving. And then boom, it skyrockets, it shoots, and all of a sudden all their symptoms kind of start to dissipate and they feel great. So there's all kinds of different variations. I'm sorry, we don't really have it's not really a clear black and white answer. That's why it's really important to go to an experienced clinic, and we always are very transparent. If it's something that, I've never treated, I can't really give that patient any feedback. And so it's important to tell them that. But if it's something like autism or orthopedics, where we've done hundreds and hundreds of them, I can really narrow it down a lot more on what that patient might be expecting over the next course of a couple weeks or a couple months. So I hope that was a little illuminating and helpful to you. Subscribe to us to get all the latest updates on regenerative medicine from us, and we'll see you in the next video.